The top U.S. public health official warned this week that it was still too early to talk about COVID-19 being under control, despite numbers related to the Omicron variant continuing to fall. The Centers for Disease Control point to a downward trend in daily new cases and hospitalizations, while daily deaths now exceed 2,000 on the 7-day moving average. As public health officials increasingly talk about moving to a period where COVID is no longer a crisis and disrupting daily lives, the president's chief medical advisor, Dr. Anthony Fauci, was quick to point out that the United States was still a long way off from reaching that phase in the pandemic.
We continue to move toward a time when COVID won't disrupt our daily lives. A time when COVID is no longer a crisis, but rather something we protect against and treat.
That's Jeff Zients, the White House coronavirus response coordinator, amid promising signs that the numbers were trending downwards.
Although it's encouraging that Omicron appears to be causing less severe disease, it's important to remember that we are still facing a high overall burden of disease. Hospitalizations have rapidly increased in a short amount of time, putting a strain on many local health systems.
She was quick to point out that milder does not mean mild, given the substantial number of deaths, with over 870,000 succumbing to the virus in the US alone. On January 21st, over 3,400 people died in one day.
Where we want to be is that sufficient control. And control, we mean not eradication, like we did with smallpox, that's unreasonable. Not necessarily elimination, like we've done with polio and with measles by mass vaccination campaigns, but a level of control that does not disrupt us in society, does not dominate our lives, does not prevent us to do the things that we generally do under normal existence.
A new kind of normal as it becomes increasingly possible that coronavirus will not be completely eradicated in the near to medium term, if at all.